Hi, everyone. Thank you for being here today. My name is Lenore Hernandez, and today I'm so excited to talk to you about something we all use every second of every day, and that is the movement system. This system is what makes every motion in our bodies possible, whether it's walking, running, or even typing on your cell phone. We're going to dive into the components that make movement possible, like our joints and tissue, and some key structures like the hand, knee, back, heart, and brain, and show how they all work together. Let's get started. So, what exactly is the movement system? That's the question here, right? At its core, it's a network of different parts of the body that all work together to allow us to move. This includes our joints, muscles, nerves, and organs. My goal today is to help you understand how this system works, why it's so important, and how we can keep it healthy. By the end, I hope you'll appreciate how complex and amazing our bodies really are. First, let's talk about joints and their role in movement. Joints are where two bones meet and they allow us to move. There are three main types of joints. We have synovial joints, cartilaginous joints, and fibrous joints. Synovial joints are the most movable. These are our knees, our shoulders, and hips. Our cartilaginous joints are the ones in our spine. They allow for limited movement, far less than the synovial joints, of course. And then we have our fibrous joints. These are in our skull, they don't move at all, and their main purpose is for protection. Synovial joints are especially cool because they come in different shapes, such as ball and socket joints in our shoulder. We also have hinge joints in our knees, look much different, and then our pivot joints in our neck, for example. These are different types of joints that let us do everything in our lives, from running to nodding our heads. Next, we have the types of tissues in the body that make movement possible. There are four main types of tissues. We have connective tissue, muscle tissue, nervous tissue, and epithelial tissue. I'm going to dive into each one. Connective tissue includes things like ligaments and tendons, and it's what supports and connects different parts of the body. We have muscle tissue, which comes in three different types. There's the skeletal, which allows us to move voluntarily. We have cardiac, which keeps our heart beating, and smooth muscle, which moves things along like our food through our digestive system. And the nervous tissue, it is what sends signals from the brain and the spinal cord to the rest of the body, coordinating our movement. And the epithelial tissue is what lines and protects our organs like a protective barrier. All these tissues work together to help us move and function. So first, we're going to talk about the hand. It is one of the most complex and fascinating parts of the movement system, in my opinion. I've included a little diagram here just for visuals. But did you know that the hand actually has 27 bones? This includes our carpals in our wrist, metacarpals in the palms, and our phalanges. The thumb is especially unique because it has a saddle joint, which gives us a wide range of motion along with the ability to grip and pinch things. The tendons and ligaments in the hand work together to create fine motor skills. This is what lets us do precise tasks like writing or typing. And the hand is not just about movement. It's also about communication and creativity, like when we gesture, draw, or play an instrument. Think about all the things we do with our hands and how effective they are in our daily lives, and how there's a whole language based on the motion of our hands. It's quite amazing if you think about it. So now we're on to the knee. We're going to go over the stability and motion. The knee is a hinge joint, which means it allows movement in one direction, bending and straightening. It's made up of three bones: the femur, which is your thigh bone, the tibia, which is your shin bone, and the patella, your kneecap. Ligaments like the PCL and ACL stabilize the knee, while the meniscus acts like a cushion to absorb shock. The knee itself is so essential for activities like walking, running, and jumping, but it's also prone to injuries, especially in sports. I know just about everyone has known somebody who's torn their ACL in sports, and ACL tears and arthritis are so common in knee problems. So now let's look at the back. It is the central support system of our body, the core structure that supports our whole body. It's made up of 33 vertebrae divided into sections. We have, our neck, upper back, lower back, and the sacral and coccygeal. The intervertebral discs between each vertebrae act like shock absorbers, while the ligaments and muscles stabilize the spine and allow for a little bit more flexibility. The back lets us bend, twist, and lift, but it's also really easy to strain. Herniated discs and lower back pain are super common, especially if we don't practice good posture, and I am so guilty of it, working on it every day. Let's shift our focus to the heart now. I did include a little diagram for visual aid, but you might not think of the heart as part of the movement system compared to some of, your hand, your back. That comes to mind first, of course, but the heart is crucial. It's what pumps the blood, it delivers oxygen and nutrients to our muscles. Without it, our muscles wouldn't have the energy to move, and the heart is made up of cardiac muscle, which is unique because it contracts on its own without needing signals from the brain. It works non-stop though, pumping about 5 liters of blood per minute at rest. Imagine how much blood it's pumping with slight movement, and then think about how much it's pumping with like an intense workout. It is crazy to think about that. Finally, let's talk about the brain, the control center. The brain is in control of all of our movement. Um, the motor cortex in the brain plans and executes the movement, while the cerebellum helps with coordination and balance. The brain sends signals through the spinal cord and nerves to tell muscles what to do. It's also responsible for involuntary movements, like our heart beating, breathing. I've included a diagram here with the anatomy of the brain. If the brain is damaged, for example, by a stroke, it can seriously affect movement, and this shows how critical it is in the movement system. Next, let's talk about the integration of the system in movement. How do all these parts work together? Let's take such a small example such as walking. So first, your brain is going to send signals to your leg muscles to move. Then your joints, like your knees and ankles, provide that range of motion. And then we're going to have our heart pumping blood to give your muscle the energy they need. And then your back will be stabilizing your posture and your arms swinging for balance. It's an amazing coordination of systems all working together seamlessly. Now think about that for any other kind of active motion, all the things that go into places. Wow, mind-blowing for sure. So obviously, maintaining a healthy movement system is so vital in our everyday lives. And here are some tips that can kind of help with all of that. We need to exercise regularly to strengthen our muscle and joints, eat a balanced diet to provide nutrients for our tissue, maintain good posture to avoid back strain, stretch to keep our joints and muscles flexible, and of course, avoid injuries by practicing proper form during physical activity. These are all small things that can make a huge impact in our body and how it moves. We only have one body, so we need to take care of it We always hear people say health is wealth, and I am a firm believer in that. In conclusion, the movement system is a beautiful combination of joints, tissues, and key structures, like the hands, knees, back, heart, and brain. Each part plays a unique role, but together they allow us to move, work, and enjoy life. I hope that you learned something in this presentation. Thank you so much for listening.